Hi, I am Instructor Dickinson and I am going to perform a sterile dressing change.
The goal of wound care is to clean and protect the wound with the dressing without contaminating the wound or causing trauma to the wound. Patients should experience minimal pain or discomfort. Step 1, verify the order for the dressing change. Wash your hands, remove all jewelry and long sleeves, gather the equipment needed, and explain the procedure to the patient.
Hi, Mr. Happy. I'm Instructor Dickinson and I am going to perform your dressing change. Are you okay with that? Is now a good time?
I think it's okay.
Can I first verify your name and your birth date, please?
I'm John Happy, August 11th, 1955.
Thank you. First of all, are you having any pain right now?
Well, just a little bit. I was given something for pain about 45 minutes ago, and I would say my pain's about a 2. That's about as good as it gets.
2? Okay, all right. Well, I think we're okay to go ahead and proceed with your dressing change.
Okay.
Okay. Ms. Dickinson properly identified the patient and assessed the patient's need for analgesia. If Mr. Happy needed pain medication, you would first administer the prescribed medication and then allow it time to work, usually about 30 to 60 minutes. Step 3, place a trash can or a red bag at a convenient location. Position the patient in a comfortable position that allows access to the wound area. If you have a wound where fluids will be copious or mobile, such as splashing, you want to use PPE with a face shield or goggles. If you use a patient's trash can, be sure to take it out with you upon leaving the room.
Mr. Happy, I'm going to raise your bed. It just helps me to be able to work at a height that's comfortable.
Okay.
I'm going to put the side rail down, but I'll be right here the whole time.
Okay, I won't climb out.
Okay. Apply PPE and gently remove the soiled dressing. If it is stuck, use small amounts of normal saline to assist in the removal of the old dressing. You don't want to rip it off if it's stuck to the patient's skin.
I'm going to raise your gown here just a little bit. And I'm going to pull this down, the sheet, not to expose you too much, okay? I'm going to peel the tape back here so you may feel a little pulling.
I hate that tape.
I know.
Pulls on my hair.
Sorry about that.
Okay. Note the presence of drainage. Note the amount, type, color, and odor. Dispose of the dressing. You want to note any serous, which is clear, serosanguinous, which is light red, sanguinous, which is bloody, any green, yellow, or brown drainage, which would indicate possible infection. You would also inspect the wound site for redness, edema, ecchymosis, which is bleeding under the skin or bruising, drainage, and approximation, which is closing of the wound edges. Check the status of the sutures, staples, drains, or tubes if present. Note any problems so you may include it in your documentation. Notice how Instructor Dickinson is removing her gloves so the soiled dressing is contained within the dirty glove. And next she's going to put it in the trash. She is going to perform hand hygiene. Notice how she does not fully step away from the bed. Next, she is going to open the sterile dressing kit